We are live here at Roswell Park Comprehensive Cancer Center up in the Breast Imaging Center, where you will come if you have scheduled your mammogram. And that is the goal of our annual Mammothon drive, to encourage women over the age of 40 to schedule your yearly screening. When should you be having these conversations? What if you're not the age of 40 yet, but maybe you have some risk factors? We are discussing all of it this morning. Joining us this morning to answer some of those questions, Dr. Lauren Burkard-Mandel. Thank you so much for being with us this morning.
Happy to be here.
So why is 40 the critical age to get a mammogram?
Yeah, so studies show that your breast cancer risk increases right around age 40 and continues to increase in the years between 40 and 60. So we recommend that women start breast cancer screening at 40 because that's when we detect the most breast cancers.
Although it feels like cancers are becoming more common for women who are younger. What if you are younger than the age of 40? When should you be having these conversations?
Yeah, we recommend that women start these conversations with their doctor, so your family medicine doctor, your OBGYN, around age 25. And if you have a family history of breast cancer or a family history of other cancers, or you know that there's genetic mutations in your family, these would all be reasons to start screening earlier than 40.
And once we hit 40, we know that you recommend one every year. Why should a woman have that yearly screening?
We know that annual mammogram saves the most lives, and so we recommend that women come in every year. It also helps us track changes over time, and so annually is really the best formula.
When we visit the technician, how long does the appointment take? And, some of those questions that women might have if they haven't had a mammogram.
Yeah, mammogram takes only a few minutes. We recommend that women block off about a half hour for parking and scheduling and all of that. But generally the appointment takes about a half hour, and when they come in, they'll have their pictures taken, and then patients go home, and over the next few days, their images will be read by one of our breast imaging specialists here at Roswell. And then those results will be sent to their ordering provider and sent to them in the mail directly. And if we need any extra pictures or additional workup, they can come right back and see us.
We know technology has also come a long way in terms of detection with 3D imaging and those sorts of things. In your experience, just how helpful is that to have all of these tools in the arsenal to detect cancer early?
Yeah, immeasurably helpful. All of these tools have been shown over many studies to really help radiologists make the best decision for patients. And also, they've helped decrease any exposure to radiation that the patients might have. So this technology has helped not just us, but the patients as well.
Dr. Burkard-Mandel, we appreciate you being here this morning, and your expertise is really invaluable. So thank you so much for being here. Of course, if you do want to schedule your mammogram, there's a QR code on your screen right now. Our goal for our Mammothon, 550 women to schedule your mammogram through Friday, and we're doing really well, Scott, but we really want to drive home the point that it's important to schedule that appointment today.